Welcome everyone to sponsor Symposium number 6, entitled Secure, Efficient, and Scalable Enterprise Informatics Solutions in a World Affected by COVID. My name is Palma Petrilli, and I lead strategy, engagement, and marketing at Philips Canada. I am thrilled to be your moderator for today. This session will consist of a live presentation with time left for Q&A at the end. Please do submit your questions in the chat throughout the presentation. If we don't get to all of them, I'll be sure to connect with you guys all via the virtual event platform. So let's get the conversation started. In this session, we will discuss how data-driven, actionable insights and informatics solutions can address staff shortages and access to care. Please join me in welcoming to the virtual stage, Nathan Bluvol. Nathan leads Philips' National Informatics Practice for Canada, and with his team, advises and oversees all client-facing solution engagements, deployments, and ongoing support. Under his leadership, Philips has engaged deeply with healthcare organizations across Canada on digitization initiatives and has deployed enterprise solutions that have directly impacted and improved patient care. Nathan is a professional engineer and graduated with a bachelor in computer science, a bachelor in electrical and computer engineering, and a master's in medical biophysics. Without further ado, let's welcome Nathan to the virtual stage.
Thank you, Palma, and thank you to all eHealth attendees for joining us today. I'd like to start by acknowledging what a challenging time we were thrust into at the onset of COVID. Even prior to COVID, challenges in staff shortage and access to care existed. However, both were amplified during the pandemic. On the left-hand side of this slide, you can see a snapshot of what is currently happening in Canada. And in short, and in a recently released article by CTV News on May 16th, Dr. Catherine Smart, president of the Canadian Medical Association, noted that our healthcare system and health workers are in a state of crisis we've never seen before. The rate of burnout is double what it was pre-pandemic. Access to care has been similarly effective, with wait times for diagnosis and treatment, as you can see on the right-hand side of this slide, from 18 to 53 weeks on average, depending on the province. This resulted in delayed and missed care due to the COVID burden, with an estimated 4,000 excess deaths between August and December of 2020. So staff shortages and access to care were and continue to be top of mind in the Canadian healthcare system. You may not be surprised to learn that there's no all-encompassing cause for staff shortages and access to care. In a York University study conducted by Shahram Zahir and colleagues in August 2019, they theorized that supportive supervision is key. While in addition to this aspect, HSD metrics, who measures employee perception, found that scheduling, feeling appreciated, pay, and excessive job demands contribute strongly to turnover in the healthcare setting. Similarly, we can learn from an access and efficiency workbook published by Health Quality Ontario. Amongst the many factors, the staff scheduling, again, and lack of direct patient interaction through the patient journey can have an impact on access to care. This is in addition to the significant backlog that was caused by COVID itself. So since there's no single cause, the solutions are also multifaceted. And one key takeaway, it's important to remember, is that technology alone will not solve all these issues, but it can help if it's directed in a really focused way. In a survey conducted by the American College of Healthcare Executives, CEOs ranked staff shortages as the #1 list of concerns in 2021. Right behind nursing shortages, medical imaging technologists ranked as the #2 shortfall. Anecdotally, we hear the same thing in Canada from our partners. If we focus in on this important area, namely imaging, we know that simplifying workflows using advanced tools such as AI-based automation, which can also provide predictive modeling on equipment usage and competency assessment, will have a significant impact. Using digital tools to more closely connect to patients and to monitor those interactions can also help improve access to care. So how does this connect to the overarching Philips vision? Philips has the depth of perspective from home to hospital needed to break the boundaries standing in the way of organizing healthcare around the patient. We collaborate on designing innovations to seamlessly bring together people, data, and technology to help our customers achieve their quadruple aim, namely improving the patient experience, improving the health of individuals, and improving the work life of health professionals, all while reducing the cost of care. So Philips aims to exceed our customer expectations by delivering on that quadruple aim, notably in the context of the issues that I just described, staff turnover and access to care. Improving the patient and staff experience is paramount. Although our solutions are aimed at all four of these goals, our informatics portfolio can help ensure that patients feel connected and staff have the tools at their disposal to perform their duties efficiently and with minimal burden. So the background within which we look to achieve this quadruple aim, it's complicated. Although the data exists today, it comes from many different and disparate sources and into many different systems of record. Taken together, it can paint a great picture of the patient. However, we recognize that there's a challenge in doing so and providing only the needed information at the right point in time, all while ensuring patients and staff feel supported throughout the journey. Our Philips solutions are focused on these challenges and aim to meet them from an enterprise perspective. We have solutions across the informatics portfolio that have security baked in from an R&D standpoint and from deployment perspective, meeting ISO 27000 specifications and ensuring confidentiality and data integrity. They're efficient in nature, ensuring workflows are optimized where possible, and they scale across systems, departments, and enterprise, as you can see on the slide here. That's the power of the Philips informatics ecosystem, the power of our platform. So we talked about the quadruple aim. Now let's go through a patient journey. I'd like to go through 4 patient touch points from a patient's perspective: the primary care physician's office, the patient's home, the community hospital, and the physician's home. We'll round out this patient journey with a couple of real-world examples of the Philips solutions in action. Okay, so let's start in the physician's office. Michael, a 55-year-old who presents to his primary care physician with the potential COVID-related pneumonia, may need diagnostic imaging. He might be sent for a chest X-ray where an opacity in his right lung is observed. In addition to the X-ray, a radiologist or even the primary care physician could pull a complete record using the Philips interoperability solution, which shows all of the relevant imaging data that this patient has completed in the past. Instead of going for additional imaging or sending additional testing, the patient's records are instantly available, building a more complete picture and helping with coordination of care. So by reducing the need for additional testing, Michael isn't taking up someone else's spot who may be waiting for an appointment, and that improves access to care for Michael and for other patients. Michael might be scheduled for a chest CT, but following that, that would be the gold standard for COVID-19 pneumonia detection and determining risk of imminent patient degradation. So once he's scheduled for a chest CT, Michael is now at home. He receives a text from the Philips Patient Navigation Management software. This both reminds him about the CT appointment and prepares him for the procedure. These reminders might be carefully spread out over time as the CT procedure date approaches, and the method of interaction directly with patients has shown an increase in patient satisfaction because the patient feels they're prepared. This interactive tool also helps staff gain a better assessment of the patient knowledge and readiness for their procedure. Ultimately, we've seen reductions of up to 14% in late cancellations. Again, this has an impact on access to care since there's no wasted appointment time and wait lists can be optimized for other patients. It also helps with potentially staff turnover by ensuring the patients are all ready for their appointments and reducing the burden on staff to help patients prepare for the procedure and to rejuggle potentially staff scheduling, something we don't want. So let's say Michael now arrives for a CT at his local community hospital, where technologists performing the CT may need remote support from imaging experts, and that could be provided by the Philips Radiology Operations Command Center. The Radiology Operations Command Center, or ROC as it's known, is a multi-vendor, multi-modality, multi-site telepresence solution that provides advanced tele-acquisition capabilities and seamlessly connects imaging experts at a command center with technologists at scanners across care locations. You can think of this solution as a hub and spoke model where all the experts are centrally located and can provide that over-the-shoulder support if needed with a direct interface to any vendor's equipment, and namely in this case, the CT. And that's truly virtual scanner access. It can be done through multi-level access-based credentials. It's lean in terms of IT deployment, very little bandwidth required, and avoids the need ultimately for highly specialized staff on site, which improves scheduling for patients and increases staff support. Could have a direct impact on the burden put on staff and helps to balance that staff loading. So once the image is collected, the radiologist will be required to read it, of course. And even though the radiologist may not be on site, they maybe have been asked to report from home during a COVID outbreak, they're still able to perform that remote diagnosis from their house. They're equipped with a full suite of tools with the Philips View PACS solution, which is able to manage the interpretation of those images, and advanced analytics capabilities known as the Philips IntelliSpace portal, which have tools like quantitative lung nodule analysis and 3D automated measurements and image co-registration. So all these great tools that are available to them. These tools help the patient by reducing the potential for false positive diagnosis and lowering the potential COVID risk for the physicians by reporting from their home environment. So Michael's results are therefore delivered accurately and on time. This patient example we just walked through takes place within a number of locations, but largely within one health system. To recap, Michael's imaging results are reviewed remotely using the Philips View PACS solution, aided by the advanced analytics capability and IntelliSpace portal. His CT is performed by technologists locally, but supported remotely by the Radiology Operations Command Center, or ROC. He has bi-directional communication directly with the hospital using the Philips Patient Navigation Manager tool, and his family doctor or radiologist was able to access all of his records using an information exchange that's supported by the Philips interoperability solution. All of these solutions use the right data presented at the right time and have an impact on access to care and can help reduce the burden on staff. The Philips interoperability portfolio allows us to stitch together multiple data from different systems, whether it's in a department by routing data from many different vendors, or between departments with different systems of record, or within a region with different enterprise solutions. And finally, an aspirational aim of Canada Health Infoway with a pan-Canadian strategy around interoperability, we also have the technology to enable seamless data flow across locations, across provinces. Let's walk through a couple of real-world examples where Philips has already delivered interoperability solutions. We'll start with Ontario Health. So we actually have a solution in place at Ontario Health, which covers 145 hospitals. The solution is part of what is known as the Health Information Access Layer, or HIAL, and allows primary care physicians or radiologists to access through a portal, one of which is the eHealth portal, the patient record. And over 20 million patient searches are performed annually with this solution. It registers about 40 million studies on a yearly basis that is consolidated from the diagnostic imaging repositories. There's 4 of those in Ontario. This provides a more complete patient record regardless where the data has been collected, thereby reducing the potential for repeat imaging. If you think back to that patient journey that I just walked you through for Michael, using this solution, Michael doesn't need to repeat any imaging and add to the already long wait list that exists. He's moved to the right point of care quickly, and this improves access to care for both him and other patients waiting for testing. The second example comes from the Veterans Integrated Service Network, or VISN-1 in New England. There's 18 of these VISNs in the US, managed by the US Department of Veterans Affairs. VISN-1 in particular has 11 medical centers, 45 community-based outpatient clinics, and 6 community living centers. So during COVID, of course, cardiologists were caring for patients and they became very busy doing so. This resulted in a significant backlog for reporting out on imaging or data that was being collected and needed to be reported through the IntelliSpace cardiovascular tool, example, reading echocardiograms. Philips partnered with VISN-1 to provide an information exchange which enabled pooling of the cardiologists across 7 medical centers. All cardiology data could be shared with the Philips interoperability solution, leveraging the expertise and capacity where needed at any one of these 7 medical centers. It's a powerful example of how impactful the Philips solutions can be in removing those data silos and helping directly with staff shortages and improving access to care. I'd like to end with a call to action for you. You too can benefit from a partnership with Philips. We're offering all our eHealth attendees today with a complimentary assessment, and I'll discuss what that means on the next slide here. So the Health Information and Management Systems Society, or HIMSS, as many of you may know, created what's called as a digital imaging adoption model. This builds on the success of the electronic medical record adoption model, which you also may know called MRAM, which measures clinical outcomes, patient engagement, and clinical use of EMR technology to strengthen the organizational performance and health outcomes for patients. The MRAM model has been used by many organizations, 440 of which are at a stage 6 maturity. So much like MRAM is to the electronic medical record, the digital imaging adoption model, or DIAM, is a tool to communicate with organizations how to prioritize, how to move towards that first time right precision diagnosis, all the way to the right there on the slide in stage 7, within the context of diagnostic imaging. This is a free assessment that leverages the combined strengths and capabilities of Philips and your organizations. And Philips is the first organization to partner with HIMSS to deliver this assessment. So very briefly, how does it work? You request a DIAM survey either through HIMSS or your local Philips Canada representative. We work with you and your team to identify the key stakeholders and use a survey-based tool to complete the data collection. A HIMSS representative completes the data analysis, which includes a baseline scorecard, which can be used as a guideline for your partnership with Philips. And we can look at things like creating governance and strategy to get you to that stage 7 precision diagnosis. And the consultative approach is, of course, fully aligned with the quadruple aim that I discussed previously and can help you address those challenges that I noted today of staff turnover and access to care. All right, I'd like to leave you with an impression of why Philips is truly a remarkable partner. We have a long history and deep understanding of clinical workflows. We have a global footprint across many deployed solutions and significant experience from small to large projects. We consistently invest in innovation and showcase this innovation through our broad portfolio, and we're recognized for this innovation through many customer feedback awards. So please reach out to me and the Philips Canada team if you have any questions. You can actually take out your phone and scan the QR code, I'm told, using the Photos app. That'll get you to the complimentary DIAM assessment, and you can fill in your information. Or if you have any other questions, you can use the link. I think that was added to the chat. Thank you very much for your attention, and I look forward to partnering with you. Over to you, Palma.
Great. Thank you, Nathan. So we have a few questions that have come up in the chat. Let's go through them right now. The first one is, in your opinion, should interoperability be mandated by regulatory bodies? What would some of the advantages and disadvantages of this be?
So clearly it's an initiative that's been put forward by Canada Health Infoway, and rightly so, as I just talked about, right? I think, obviously the benefits, as I just outlined, could be a patient really just taking their record anywhere in Canada, right? And that's pretty powerful stuff, even within a province, even within various healthcare systems. The challenges are quite clearly in Canada that the provinces actually maintain healthcare within any specific province. So, I mean, that's a challenge that Canada Health Infoway hopefully can solve, and we're happy to partner with them since we have the technology to support that.
Great. There's a couple more that just came directly here. How do you see the democratization of data having an impact on access to care?
Yeah, that's a great question. So, it's important to recognize that more people are going to be empowered by their own patient data. We have patient portals today. In fact, we have the Philips View PACS portal that allows that kind of visibility for patients. The key here is to make sure that, I think healthcare providers would want this, to make sure that it's a curated experience, because that information is often can generate confusion or it's difficult to interpret. Obviously, those healthcare providers have a lot of experience and education in that space. So that would be the approach there, Palma.
Great. Another question here. Many people now have either an Apple Watch or other personal device. How does this feed into the patient record?
Yeah, I mean, this is a trend that's going to continue for sure. Philips acquired BioTel, actually, a company that's kind of in the space where, for example, they have blood pressure cuffs that are wirelessly connected or connected to a health network system or a health team. And can actually collect that data and inform that team so that they have, kind of that live patient direction. I think that's going to continue with all of the devices that we have today.
Great. A few more here. There was an article published today by Axios about healthcare workers mobilizing and pushing for workplace changes like staffing ratios after the multiple COVID waves. How can Philips help with this issue?
Yeah, that's a tough question. So I mean, obviously technology can't solve all of that, but think back to the solution that I talked about with the Vision One, where we partnered and helped with that staff load balancing. I think that could be one of the solutions that could come forward and could help with that staffing ratio that we just talked about.
Yeah, and then I see another comment here. I don't know if you want to comment on it. It's not a question, it's just a comment, Nathan, but with central repository bodies managing this promotes neutrality and creation of vendor agnostic solutions versus proprietary solutions. I don't know if you want to comment, but that was just a comment put in the chat.
Yeah, 100%. And I think that's part of the value. That's the democratization that we talked about before, even to patients, but also to vendors as well, which holds us to a higher standard, frankly, to provide value with our solutions. So yeah, that's a great comment. I agree.
Great. I don't think I see any more questions here in the chat. So I guess the last action is, if you'd like more information on the Philips-led HIMSS DM assessment, guys, please, there's a link in the chat. There's also the QR code, scan your phone, submit a form, and one of the Philips Informatics specialists will reach out to you. Also visit our booth. We have some great solutions in there. And thank you very much for joining us today. Please connect with Nathan and myself if you have any questions.